Emergency medical technician Nigel Flanagan and paramedic Claire Carpenter had just arrived at an accident. Martin was crossing a side road when he was hit by a car.
Martin, can you wiggle your toes?
I'm dying, man.
Say it again?
I'm dying, man.
You're not dying. You're not dying. Martin, when you fell over, did you bang your head at all?
No.
So you remember everything?
Half of my leg.
Okay. When you stop using that.
They've given him gas and air to help with the pain before they try to get him into the ambulance.
So big breath to this. You'll need to move your leg, okay? So.
Don't you move.
Oh, yes. Sorry, it's to be a little bit tight, okay? Ready?
You're alright, Martin, alright?
Alright, there's going to be a bump coming up, okay?
When he's safely inside the ambulance, they can remove the splint and examine his injury.
Martin, I'm just taking this bandage off, just have a look at it, okay? Don't suck on that gas.
Although the car was only travelling slowly, it's caused quite a serious injury.
Hey, you can feel me doing this? And feel me doing this? Martin, I'm just going to press on your ankle, just to see if you've got a nice little pulse on your ankle. I'm sure you have.
The gas and air isn't helping Martin, and so Claire decides to give him a stronger drug.
We're going to give you some morphine for the pain, okay? But morphine quite often makes people sick. So we're going to give you an anti-sickness drug slowly first, okay?
With the morphine taking effect, Nigel finds out from Martin how the accident happened.
Was you walking or running?
Walk. I was walking. And I was sorry, there's nothing there, and I turned my head on the other side, and we just feel the smash from it.
And she's hit you obviously at this side, your leg, and you've gone down to the ground.
And I was
okay.
Nothing there.
We'll see a doctor. They'll X-ray as quick as they can, and then once they get the X-ray results back, they can decide what's best for you and what's best for your leg. Okay.
They decide to take Martin to hospital as quickly as they can and set off under blue lights.
He's got an open fracture to his fib. I think he's done his fibula and tibula, which are the two bones in your leg. The most important thing with a fracture, or an open fracture, is he's got good feeling to the top of his leg, which he has, haven't you? And the bottom of his leg. He can move his toes. He's got a good pulse at his ankle, which means blood is getting past the fracture into his ankle. If he wasn't getting blood or movement to his ankle, we'd have to correct that. We'd have to move his ankle so blood is getting there. Because obviously if it's not, it's dead tissue, it's dying tissue. And we'll have an X-ray and we'll find out what he needs done, if it's going to be surgery or if it's going to be a cast. There you go.
According to the Department for Transport, last year there were over 30,000 pedestrian road casualties in Britain. Nigel and Claire often treat patients like Martin, and his injury is quite common.
That can happen at low speed, which is what happened today, or high speed. If it's high speed, then our treatment might have been different. But a lady said 5 miles an hour, so she was just pulling around the corner. So it's just wrong place, wrong time for our gentleman today. Walking across the road, getting ready for work at 9 o'clock. Doesn't look like he's going to make work today.